Hi, my name is Jessica Shank. I'm originally from Kearney, Nebraska. I did my undergraduate training at the University of Nebraska at Lincoln, followed by medical school at the University of Nebraska Medical Center. I then moved out to the East Coast and did my general surgery training at Albany Medical Center, followed by fellowship training in endocrine surgery at Johns Hopkins University in Baltimore. Endocrine surgery is an amazing specialty. I have the opportunity to kind of combine both surgery and medicine into one field, which makes it both complicated and incredibly interesting. The anatomy of the parts of the body that I work with are also very interesting and delicate. The neck is an incredible area with high real estate, very important structures to be operating in. Working in a specialty that's both medicine and surgery allows me to work with a multidisciplinary team to tackle patient problems and create individualized medicine and care for these patients. As an endocrine surgeon, I see a variety of disease processes, both benign and malignant, primarily of the thyroid, parathyroid, and adrenal glands. I also specialize in the cervical lymph nodes of the neck. In particular, I focus on the minimally invasive approach for parathyroid glands and laparoscopic minimally invasive approach for adrenal gland diseases as well. Interacting with patients on a day-to-day basis is what's most important to me and what I find most valuable in my career. When I sit down with a patient for the first time, I want to establish a rapport, connect on a level outside of what brings them in to the clinic that day. They can be in an incredibly stressful situation, so I try to kind of back up, learn about their background, get to know them as an individual first, connect on a different level before we can tackle those big problems and the medical issues that bring them into clinic. I enjoy academic medicine for a variety of reasons. Initially, I developed an interest in residency where I had the opportunity to train both those junior residents underneath me and also the medical students that worked with me. That love for teaching has just expanded once I've developed my subspecialty training. I love talking about endocrine surgery, telling both residents and medical students about why I love the field and why they can enjoy the field as well. In addition to that, I have a joy for research that expanded once I was doing my fellowship training at Johns Hopkins University. I had the opportunity to look at how patients were impacted with their disease process, and particularly the psychological impact of the disease process. And I would like to continue looking into that research realm while working at the University of Nebraska Medical Center.